Hello, this is Dr. Stanley Lang. Welcome to this video on the series of chronic Lyme disease. And the question that I'm asking today is, can neuropathy be a symptom of chronic Lyme disease? And the answer is, yes, it can, as you might have already guessed. Not only, though, neuropathy, but any neurological symptom can be chronic Lyme disease. In fact, some of the radiologists now, when we see an MRI report on somebody that might have multiple sclerosis, they'll actually put in their report consistent with MS or chronic Lyme disease. So chronic Lyme disease can mimic many different neurological conditions. And one of the first ways that I first started to see chronic Lyme disease was in significant memory loss. And I still remember very well the patient that presented with this, who was a young man in his 20s. He was less than 25 years old, and he was having profound memory loss to the point that he actually was acting like somebody with advanced dementia. And he was not able to work anymore because he couldn't find his way to work when he would start driving. And so we started evaluating him. I eventually made the conclusion that he probably had Lyme disease. In this case, his blood test was positive. So that was helpful in the early years of trying to figure out what is chronic Lyme disease and what is not. And so I started him on treatment for chronic Lyme disease, and lo and behold, his memory started to get better almost overnight. I was shocked because it was the first time I'd ever seen this. And he eventually fully recovered, and then about 2 years later, he came back with exactly the same symptoms. And then about 5 years later, he came back with exactly the same symptoms. So I've actually seen this person 3 different times for memory loss as his only real symptom of chronic Lyme disease. So this is really interesting because what I've seen with chronic Lyme disease is that when people have recurrence, let's say that they get better from their symptoms, a lot of people with recurrent chronic Lyme disease will have almost the same symptoms when they get their symptoms back. And so that's often a tip-off to me that they are dealing with chronic Lyme disease. And so in this case, that was the first of many different neurological symptoms complexes that I've seen over the years now. And I have seen everything from what we call peripheral neuropathy, which is tingling and other sensations in your extremities, your arms and your legs, and especially the feet, which can be very disruptive. And peripheral neuropathy can actually be chronic Lyme disease. And even isolated severe ringing in the ears, which is called tinnitus, can be Lyme disease. And I have a few patients that have recurrent bad explosions of tinnitus, and then when we treat for Lyme disease, the symptoms rapidly improve. If we don't treat, they don't improve. So the point being that virtually anything in the neurological symptoms, anything in the neurological system can be infected with this organism, and once it's infected, it's pretty hard to make sure it's completely gone. That gets back to the chronic Lyme disease treatment strategies, but there are ways that you can keep it at bay. So the idea is, how can we keep this infection at bay if it's going to be infecting my neurological system? So in future videos, we're going to talk about how you do keep it suppressed, and you can keep it suppressed much of the time if you do all of the things that are critical, if you do them correctly. And I'm going to give you some hints on how you do that correctly. So I hope you found this helpful. God bless, and have a great day.